We're pleased to have three of our own capacity research team presenting their work from the CHASE research program. First up, we welcome Dr. Brent Hagel, who is a professor in the Department of Pediatrics and Community Health Sciences in the Cummings School of Medicine at the University of Calgary. He is director of the Healthy Children, Families and Communities program of the Alberta Children's Hospital Research Institute. His key research interest area is child and adolescent injury prevention, currently focused on the determinants of child and youth bicycle, pedestrian, ski, snowboard, and ice hockey injuries. Next up, we will have Dr. Linda Rothman, who is an associate professor at the School of Occupational and Public Health at Toronto Metropolitan University. She is an epidemiologist and has been involved in research related to sport, playgrounds, concussions, road traffic, and car occupant injuries. Her research focus has been on child, pedestrian, and cycling injury prevention related to school travel and the built environment. Finally, we will welcome Dr. Emily McCullough. Emily is a postdoctoral researcher at York University in the Faculty of Health. Her doctoral research was conducted on from the fields of sociology and philosophical ethics and examined care and caring within the coach-athlete relationship in youth competitive sport. However, her research scope has more recently expanded to include road safety, injury prevention, and the built environment. So I will pass it over to you, Brent. Thank you.
Thank you very much, Karen, and grateful for the opportunity to present to you this afternoon. I would like to offer my own acknowledgement and tribute to the traditional territories of the peoples of Treaty 7. And City of Calgary is also home to the Métis Nation of Alberta Districts 5 and 6. So just to give you a little overview, we're going to start off with what CHASE is, and then we're going to move into the different objectives of CHASE and present some, not all of the information that we have gathered over the last few years. Then I'll talk about some scientific contributions of the work, the implications for public health, and then some next steps. So we know that road traffic injuries are among the leading causes of fatalities and hospitalizations for children and youth in Canada, and unsafe road environments also deter children from using active forms of transportation like walking and bicycling, activities which can have many physical, mental, and social benefits. So we developed the CHASE program of research to ask broadly, how does the built environment influence child and adolescent active transportation and the risk of active transportation injury across different Canadian urban settings? So we assembled a pretty amazing team, in my humble opinion, way back in 2016, with overall leads, site leads, incredible coordinators, co-investigators, program coordinators, and an expert advisory board. So it's a who's who of injury prevention and active transportation safety research, in my view, at least at the time. And then moving on, we had an amazing number of trainees who were very engaged and contributed significantly to the overall program of research. And finally, I would say that the breadth of partners that we had really contributed to the success of the research program, in particular the municipal involvement, which really allowed us to do things that were unique and innovative. And I hope that you're going to see that as we continue to present the information in the coming minutes. So with that, I will pass it over to Dr. Linda Rothman.
Thanks, Brent, and good afternoon, everybody. I'm going to talk to you about two kind of interrelated objectives. The first, project one, was mostly about active school transportation, whereas project two was more focused on safety and injury. So the first project that that we had been involved with was looking at the associations between the built environment and objectively measured active transportation to school, and we also adjusted for the social environment within that analysis, and that led to a publication in Preventive Medicine. Project 2A was looking at the associations between objectively measured BE and child pedestrian motor vehicle collisions and bicycle motor vehicle collisions around schools. Also adjusting for the social environment, but we also had an adjustment for the amount of active transportation that I'll talk to you about in a bit. And again, another publication in injury prevention. So basically, we all know active school transportation is an excellent source of regular physical activity. We do need to make sure that while we're promoting walking and cycling, the environment needs to be safe. We can't promote things to do things that are in an unsafe environment. School areas have increased child, pedestrian, and cyclist activity. And a long time ago, 2009 already, we looked in Toronto and we found the highest rates of severe and fatal child, pedestrian, motor vehicle collisions occurred within 500 meters of a school. Another paper that we did a little bit later was we did find that the relationship between active transportation and collisions, more active transportation and collisions, disappeared as long as the built environment was safe. And again, I'll refer to this further on. So schools are a really important target for reducing the burden of child collisions. So what are the associations between active school transportation, child, pedestrian, motor vehicle collisions, and the built environment? If you look through the literature, there is a lot, especially on active school, the determinants of active school determinants, but the findings are always pretty inconsistent. And the question that we had was this due to differences in research methods, for example, spatial units, when these measurements were taken, or were there actual differences in effects across locations? So we felt that we needed studies that use consistent methodological approaches across multiple cities across Canada. So in terms of the methods, we looked at JK to 8 regular program schools from each of the participating cities, which were Vancouver, Calgary, Toronto, Montreal, Surrey, Laval, and Peel regions. So we had quite a good representation of different settings across Canada. And we collected data in 2018 by 2019, and we stratified the selection by socioeconomic status, so the census after tax low income cutoff, and also the walk score. So how close things were. The walk score is 0 to 100, and it's how close people are to amenities, but also in terms of intersection density and things like that. Our data sources to measure active school travel. We had developed a methodology a few years before where we had observers standing at 2 locations, the most important and busy locations in front of schools, to count children walking, biking, scootering, rollerblading, and being driven to school. We did observations 20 minutes before the bell rang in the morning and 5 minutes after the school entry bell. So we did not do observations in the afternoon, but more in the morning. And the outcome was a proportion of children using AST and active school transportation, or AST. And our previous work did find that these are quite reliable in terms of test-retest and inter-rater reliability. Our collisions were police-reported collisions among children ages 1 to 12. We did look at pedestrians or cyclists within 1,000 meters of a school. We had different years, as usual. The data is not perfect everywhere, so there was different year ranges for the different cities. And the outcome was the number of collisions per school area within the 1,000 meter buffer per year, to adjust for the fact that we had different numbers of years. We also adjusted for the amount of road kilometers there are within the models in terms of exposure. The covariates, the determinants that we looked at, were school neighborhood characteristics. We had recent immigration, less than or equal to 5 years, and percent before active after tax low income cutoffs from the census. We also had the size of the schools, whether or not they were adjacent schools. In terms of density, we had how many people kids lived in that area under 13 years. We looked at land use diversity. We looked at different aspects of design. So from our secondary data sources, we looked at what's happening within 1,000 meters of the school in terms of minor, slower roadways, traffic calming, older houses, which kind of are indicative sometimes of more density, traffic signals, crossing guards, and the old houses I have twice. And then we also did a site survey, and we counted the number of intersections around the school, bike infrastructure, whether or not there was a designated drop-off area, a designated parking lot for drop-off, whether or not there were sidewalks on both sides, and we got the walk scores, again, rated 0 to 100 for each of the schools. So our outcomes are active. There's two different papers, two different sets of modeling, but I'm covering them together. One was active school transportation. The other one was child pedestrian motor vehicle collisions primarily, and I'll talk a little bit about the cycling. Our correlates were the social and built environments. We used beta regression for the active school transportation outcome and negative binomial regression for the collision rates. For the collision rates, we also looked at full models, but also by three covariate groupings. One was road safety interventions, for example, traffic calming, road environment, such as traffic signals, and the third one was land use, social environment, in terms of residential area and income level. And we also controlled for child population, the road kilometers. We looked at all cities together, but then we also did random effects stratified by city and city-specific models, and we looked at odds ratios and 95% collision confidence intervals. We did the collision analysis on all public elementary schools, but then we also conducted on a smaller sample of schools that we had the active school transportation counts. So basically, the analysis was done for all the schools in the city, and then the sub analysis was done just on the ones that were part of the Chase active school transportation data collection. We found huge variability in the built environment between cities. For example, child population density in Calgary was 500 per square kilometer, whereas it was over 1,200 in Montreal. The walk score was quite low in Surrey at 46 and ranged up to 77 in Montreal. Local roads, a lot less in Toronto. So local lower speed roadways and in Vancouver. Speed humps were really interesting. There were like none in Peel, and only the highest was 6.1% of the roadways in Montreal. And crossing guards, there's only 12% of the schools had them in Vancouver, whereas 73% Montreal. So again, wide variability in the built environment. And as a result, we also had huge variability in terms of active school transportation. So you can see Montreal had the highest, around 70%, and Laval had the lowest, around 40% of the kids counted. And even Montreal had some schools that had 0 kids arriving by walking and cycling, and some had 96% of kids arriving that way. So there was huge variability between the cities, but also within the cities. And you can see the orange I added in the cycling, really, really small percentages, 4%, 2% of kids arriving by cycling. What we found when we put all the variables in together for the all cities model, that the things that were related to more walking or active school transportation was child population density, more traffic signal density, higher walk scores, more adult crossing guards, more local road infrastructure, like slower speeds, local roads, more cycling infrastructure. And something we were a bit confused was more walking was associated with lower residential land use. And we were wondering if it just was an indicator of being less dense. Once we looked at the city-specific models, the findings were pretty similar to the overall model. However, there was variability in the strength of associations between cities. So this was kind of our main finding for the active school transportation. In terms of collisions, the total number of collisions are on the top row. They're not, you can't really compare them because there's different years for each of the data collection. But when we calculate the mean collision rate per school per year, you can see again wide variability. In Peel, it was only 0.13, whereas in Montreal it was 0.35, the rate per school per year. So again, lots of variability in the collision rates. And what I found really fascinating, and we need to look into this more, is despite the small numbers of cyclists, look at the large proportions, especially in Calgary and Laval, that make up the collision numbers. So a bit of a busy slide, but what we found in the fully adjusted model, that the things that were related to less collisions were old home density. So I guess like a more dense neighborhood, more parklands, more residential land use was associated with less collisions. The things that were associated with more collisions were traffic signal density. So the number, that means the kids are crossing the roads more. higher crossing guard density, and that is always a bit throws us off because collisions are being associated with more crossing guards. But the reason for that is the crossing guards are being put in, we think, where things are more dangerous, and we don't know exactly, these are cross-sectional studies, when the crossing guard was put in relationship to the collision. We did do another study on that I'm not going to talk about right now. There was more collisions in people with below in the areas with below after-tax low-income cutoffs. So in more deprived areas had more collisions, and higher collisions in areas with more recent immigrant populations. What we did find is not the opposite of what we thought in terms of safety and numbers. More active school transportation was consistently associated with more collisions. So that tells me that we're putting kids out on the roads where things aren't safe. And the other thing that was interesting is if we only looked at the road safety intervention, speed hump was the only one that came out significant as a protective factor, but there wasn't enough speed humps in the cities for it to come out strongly in the big model. So there is much variability in AST, collisions, and built environment between and within cities. Just a little statement about what it was associated with. I don't need to go over that. You can look at the slides again. But a big thing was that AST was associated with more collisions, and we need to get the built environment correct to protect against this. So the bottom line is the diversity in associations between AST, collisions, and built environment observed between cities suggests that directing interventions at the local neighborhood level may be the most successful rather than a one-size-fits-all intervention. We need to look at local environments in order to get it right. And we've been talking a lot in my classes about equity versus equality. We need to make this more equitable rather than looking at equality. Thank you. A little fast, but sorry.
Thank you, Linda. So folks, I'm just going to talk a little bit about additional work in our objective 2, looking at bicycling injuries in kids in the environment study. And this was full disclosure, my PhD student, Janet O'Coin's graduate work, but ably supported by many wonderful colleagues. So the bike study purpose was to assess how different built environment features and infrastructure are associated with child bicyclist injury. And for this, we used case crossover design. And this was built on a foundation established by Megan Winters and Kay Teschke's work in adults. And I think it's a really powerful design because the participant acts as their own control. And so what we did is essentially recreate the route that the child took leading to their injury. I looked at the injury site and then picked a randomly selected or a matched control site, matching by the intersection status of the injury site. And then we were able to look at effectively the variability of the different traffic features at the injury and control locations. So it is based on the case control design, but it's got that really powerful element of within subject comparison. So stable characteristics of the individual are not going to confound the relationships that we're finding. This was a multi-center study, 3 children's hospital emergency departments in Vancouver, Calgary, and Toronto. We had a total sample size of 333, and the study ran from May 2018 to October 2021, a little bit longer due to a worldwide pandemic, unfortunately. So recruitment inside the ED, we used REDCap to screen individuals for eligibility, and then to capture consent to contact forms. As you can imagine, emergency departments are very busy places. So we opted to try and do most of the interviews outside of the ED. So we contacted participants to arrange those interviews. They were about 30 to 45 minutes long. We also conducted in-person site audits along the participants' route at the case or injury site and the control locations. The interviews captured information on injury circumstances, the cycling route, safety around locations along the route, and other personal information related to their cycling experience. In terms of the audits, we had auditors blinded to whether or not the site was an injury or control location to try and guard against misclassification bias. And we assessed a number of characteristics of the area, infrastructure, traffic speed, traffic volume, route type, speed limits, traffic control and calming devices, and visibility. And then there was another component added to this study in 2021. It was a qualitative approach to explore injured child bicyclist perceptions of safety and their environment using Hayden's matrix. I'm sure you're all familiar with Hayden's matrix, looking at characteristics of the individual or the host, the agent, or the agent of injury, and the physical and sociocultural environment. We used the framework analysis, and children and parents completed short virtual interviews of open-ended questions. Responses were transcribed verbatim, and coding was completed by 2 independent coders. So in terms of the analysis for the case crossover study, I'll present some descriptive statistics and then ultimately a mixed effects logistic regression, the mixed effects for capturing the clustering that occurs because the individual has both case and control locations. We also looked at injury circumstances and the severity of injury as measured by evacuation to the hospital by ambulance or admission to hospital. And for that, we used classification and regression tree methods to inform variable selection, and ultimately a logistic regression to look at the odds of a severe injury. And then the qualitative work used the framework approach with Hayden's matrix as the framework. So you can see here, I won't get into the details, but many were screened for eligibility, ultimately enrolled, and then we had 333 individuals that were interviewed and became the foundation of the study sample. So you can see the distribution here by city. The age range is a product of our inclusion criteria. More males than females, as you might expect, and a broad range of trip distances, injury circumstances, combination of collision, falls, motor vehicle involvement in 12%, and intersection status in 13% of the injured individuals. So I'll just ask you to not share this information. This is we're trying to get this work published, but ultimately the results of the case crossover, we found that the unpaved path, no path, and grass relative to sidewalks, pedestrian paths, and multi-use paths increased the likelihood of an injury. For the case crossover analysis, we also found surface characteristics increase the likelihood of an injury for the kids. If they were traveling uphill, there was less likely to be an injury, and construction present at the site increased the likelihood of an injury, as you might expect. For the severity of injury analysis, we had 66 individuals with severe injuries, 267 with non-severe, with interesting breakdown of collisions versus falls in both groups. And you can see that again when we move on to the logistic regression analysis, where we found that motor vehicle involvement and intersections led to an over 3-fold increase in the likelihood of a severe injury. And then finally, for the qualitative component, most of the factors that were identified by kids and their parents as being protective or contributed to a safer environment were in the pre-injury, as opposed to the injury and post-injury phases of Hayden's matrix. Suffice to say, proximity to motor vehicles, a lack of protection from motor vehicles, and road surface debris were really challenging factors that the kids identified. And it's interesting to see the relationship here in terms of a subjective viewpoint from the kids and parents relative to some of the more objective, arguably, results from the case crossover and injury severity analysis. So on the topic of qualitative research, I'm going to pass things along to Emily.
Thanks so much, Brent. It's an honor to share the results of this meaningful work. We collected a large amount of qualitative data for Objective 3, so what I'll be sharing today is some high-level results from 4 outputs we developed using these data. So the third objective of the CHASE study aimed to identify implementation strategies for built environment change at the municipal level to encourage active transportation. More specifically, the goal of this objective was to better understand the barriers and facilitators associated with making built environment changes that promote road safety and active travel. Next slide, please. So to answer this question, this research prioritized the experiences of professionals working in the fields of road safety and injury prevention in 5 Canadian municipalities: Vancouver, Calgary, Peel Region, Toronto, and Montreal. Next slide, please. Qualitative data were collected by members of the research team in each municipality. Participants were recruited from the following sectors: policy and decision-making, transportation, police services, public health, nonprofit, schools and school boards, community associations, universities, and private. The research team used a combination of snowball and purposeful sampling techniques. Key informant interviews were conducted with participants in each municipality between January to December 2019, and virtual focus groups were held between July to November 2020. The original intention was to hold in-person focus groups. However, due to COVID-19 restrictions, focus groups were conducted virtually and used a third-party platform called Upwards to facilitate online discussion. We collected 739 pages of single-space transcript, and thematic analysis was used to code and organize the data, which is a useful approach for identifying patterns and themes in reference to our research question: what are the barriers and facilitators to built environment change? So for 2 of the 4 outputs for this work, we used the Consolidated Framework for Implementation Research, or the CFIR, to contextualize our findings within the broader landscape of implementation science. As many of you know, implementation science is an emerging field of diverse researchers who seek to understand how to better translate research into practice. More specifically, it is a scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice. Thus, implementation science moves beyond the individual to also account for the provider, the organizations, systems, and policy levels. Implementation science uses a range of tools and models and frameworks, such as the CFIR, which offer efficient ways of generalizing findings across diverse settings and contexts. We chose the CFIR because it is a practical theory-based guide for systematically assessing potential barriers and facilitators to guide the tailoring of implementation strategies and adaptations for the innovation being implemented, which in this case were built environment changes. So as I mentioned, we collected over 700 pages of transcript, which resulted in 4 key outputs: high-level barriers and facilitators to built environment change, barriers and facilitators in relation to health equity and vulnerable road users, barriers and facilitators from the perspectives of public health professionals in Ontario specifically, and barriers and facilitators in relation to the uptake of the Vision Zero road safety strategy in the municipalities represented. So for the remainder of my presentation, I'll provide some more details about each of these outputs, and if time permits, I have included some raw data excerpts illustrating some of these themes. So our first set of results we published in the Journal of Transport and Health. Barriers included motor vehicle prioritization, lack of funding and resources, lack of political will, and sectoral silos. Facilitators included data sharing, champions and advocates, and cross-sectoral collaboration. Data relevant to these themes mapped onto 26 of the CFIR constructs across 5 domains and illustrate that barriers and facilitators do not operate in isolation. Instead, they are woven together in a complex web that influences successful implementation. An example of a barrier is sectoral silos, as stated by a Montreal public health participant. Governance, partnerships, and collaborations are crucial to our mission. However, the efforts put into these relationships are under-recognized and poorly supported in general, like much of the work done in prevention. Data sharing was identified as a facilitator, as described by a participant from Peel Region Public Health. a data set for the region that links motor vehicle collisions, such as location, conditions, etc., to individual characteristics like health data, injury, socioeconomic status indicators. This would result in better understanding the data and how it all fits together. So our participants also discussed barriers and facilitators in relation to accessibility and health equity concerns. This work included highlighting barriers to safe and active travel for particular groups who experience marginalization. We published this work in BMC Public Health Journal. Major barriers included exacerbated risks for marginalized groups and inequities in the built environment change process. Major facilitators included equitable built environment changes and strategies for inclusive consultation. For this output, we used a health equity framework to contextualize our findings, which is broadly defined as pursuing the elimination of disparities and inequalities for people occupying a variety of social locations. So an example of a barrier is risk for marginalized groups, illustrated by a transportation participant from Calgary. Safe means more than freedom from collision-induced physical harm. It is an unfortunate reality that people in our society are targets of physical and emotional abuse as a result of their gender, sexual orientation, race, and social class, and cars can provide protection from risks other than being hit by a car. Inclusive consultation was highlighted as a facilitator, as this university researcher participant from Vancouver explained. It might have to look differently for different communities. It's not a one-size-fits-all approach. In some communities, you're not going to get anybody out to a public forum. You're not going to get any meaningful feedback. So you have to actually know what would be most meaningful for that community by having multiple pathway points for access. Maybe it's social media, maybe it's public forums, or maybe it's a community event. It's got to be diverse and it has to be grounded in the community. Our third output looks more specifically at participants from public health units in Ontario, including Peel Region, York Region, Peterborough, and Ottawa. For the three other Objective 3 outputs, responses from York Region, Peterborough, and Ottawa were aggregated into the larger data sample. However, we felt strongly that the perspectives ought to be highlighted and shared. Barriers identified by these participants included motor vehicle prioritization and municipal decision-making structures. Facilitators included partnerships and collaboration, champions and advocates, and access to data. To contextualize these findings, we utilized the Ontario Public Health Standards and mapped our results onto their 4 principles for public health programs and services: need, impact, capacity, pun unintended, and partnerships, collaboration, and engagement. The goal was to highlight how work towards the built environment change for road safety aligns with these recommendations. So an example of a barrier was the decision-making structure of the municipality, which mapped onto the impact category of the Ontario Public Health Standards. A participant from Ottawa Public Health explained, warrants are set by the municipality and dictate how certain active transportation interventions are implemented. Municipal culture that sets those warrants is really important, as they can change what actually gets implemented on the ground. Pedestrian and cycle plans are not enough. Partnerships and collaboration were identified as a facilitator and mapped onto the partnerships, collaboration, and engagement category of the Ontario Public Health Standards. A participant from Peel Region Public Health explained, it is great to have people from different but similar disciplines come together and share ideas on things to consider when working towards supporting communities, which are walkable, have active transportation, and are accessible and safe to all users. Lastly, several participants discussed Vision Zero and its impact on road safety work. These results are currently in press with the Open Transportation Journal. It's important to note that Vision Zero was not a focus of Objective 3. However, several participants discussed the role of Vision Zero when describing barriers and facilitators. At the time of data collection, the 5 major cities included in the study had adopted Vision Zero at the municipal level. Similar to our first output, we mapped our results onto the CIFR. However, because of the smaller data sample, for this paper, we mapped raw data directly onto the CIFAR domains and constructs. Data mapped onto innovation complexity, local attitudes, local conditions, and assessing context subdomains as both barriers and facilitators, while data mapped onto innovation evidence base and partnerships and connections solely as facilitators. An example of a barrier was local conditions, as explained by a nonprofit participant from Vancouver. I wish our provincial and municipal governments took their Vision Zero commitments more seriously, that investment decisions were looked at with this lens, that budgets were aligned with resolving the harm being done, that reporting and tracking were more complete, and that we didn't just accept a high number of vehicle-related injuries and deaths as being normal or an acceptable price to pay. Similar to the results in other outputs, partnerships and connections were identified as a facilitator, as explained by a Toronto participant from Police Services. With something like Vision Zero, different partners have different roles to play. If everyone plays their role well and is coordinated well across sectors, I think it has a better chance of improvement. So what does this all mean? The results from Objective 3 affirm that partnerships and collaboration across and within sectors is necessary for built environment change. For example, collaboration with public health units is crucial because these professionals bring to the table a health equity-focused lens to the built environment, which may not always be prioritized by folks working in transportation and decision-making sectors. Vision Zero as a road safety strategy has impacted built environment change in some municipalities. However, more research is needed here, particularly in the Canadian context. Lastly, an important takeaway from Objective 3 of the CHASE study is the value of qualitative data. Highlighting the experiences of injury prevention and transportation professionals working in road safety provides rich descriptions of the implementation landscape for built environment changes. It is a way of learning about contextual details that otherwise would be inaccessible. Thank you so much.
Thanks so much, Emily. All right, folks, so I'm just going to sum things up here. In terms of the scientific contributions that I think the CHASE program has made, we have 14 directly or indirectly related publications, with many more in progress and a number of conference presentations and abstracts. We've trained a number of postdocs, graduate students, and undergraduate students, hopefully building more capacity for the future. The data all really went into a CHASE database, and that was expertly guided along by Dr. Mary Soleil Cloutier and her team. With that database, we have school environment information, active transportation counts, dangerous behaviors at the schools we audited, site audit data, census information, and collision data. And I provided the link there for you if you want to take a look at some of that information. And I really hope it's a useful resource moving forward. It took us a lot of resources and a lot of time to capture it. So I think it can still be useful several years after the program is officially ended. In terms of knowledge translation, we've done a number of webinars. And I'm glad to see that CapaCITY is taking the baton on that one. I think it's a really important knowledge translation tool for other researchers and active transportation safety stakeholders. We have developed a freely available web tool on evidence and policies related to the built environment and road safety in each of the cities that were involved, and that was ably led by Dr. Sarah Richmond, guided by Dr. Allison McPherson. And then we've developed infographics with our municipal partners, showcasing the results and findings. So importantly, the implications for public and population health. Emily's summarized nicely some of this information already, but I think it bears repeating. We need to prioritize social equity in planning road safety interventions, including reducing speeds, deploying traffic calming, separating children from traffic, like bike lanes and better walking infrastructure. And then I think we need to deprioritize motor vehicle use as a transport mode. It's been getting the lion's share of the priorities from an engineering perspective for decades. And that's starting to, in my view, erode municipalities. Linda made the point, different built environment, active transportation and collision associations were found between cities. So I think there is a real need and value to local knowledge and local interventions perhaps. And then we want to continue to facilitate the municipal researcher partnerships, and we're doing so and have done so looking at interventions like speed humps, lower speed limits, in-street signs and traffic calming curbs, and the development of metrics for built environment change evaluation. So in terms of next steps, I think summarizing all of this is greater emphasis on building environments with an underlying equity lens using safe systems approaches. And then I think it's critical that we continue working with municipal partners and active transportation safety stakeholders to build capacity for built environment change. And then just to borrow another quote from the fine work that Emily did from a Peel Region public health person. We know that vulnerable populations, school-age children, seniors, those with low SES, are disproportionately impacted by a built environment that does not support health and safety. Improving the built environment should have more benefits for vulnerable populations because it's an attempt to reduce health inequities. So we have other results and other work ongoing, but that was sort of a high-level overview, and I hope you enjoyed that. And thank you for being here today to listen to us, and thank my co-presenters who ably navigated the program of research and this presentation in particular. So with that, I'll stop and invite any questions.
Thank you, Brent and Linda and Emily. This it's a tremendous amount of work that was accomplished over those 5 years and still being wrapped up now with the publications. I have a pretty, just a sort of a high level, simple question. What was the impetus to pull together this huge team and all these research partners at the beginning? Like, working with or researching children is challenging, so what was it that just led you all to come together and just say, we need to look at this across Canada?
Yeah, that's a really wonderful question. I think we had the talent, the research expertise, and a lot of the foundational work to provide us with a departure point where we could look at scaling up and out from a lot of studies that were done at the municipal level to look at a national focus for the work, and then really bring together research partners, municipal partners from across Canada to, again, try and scale up and out the opportunity that we had to look at the built environment in the way that you can't do from a single municipality perspective. So I'll stop talking there. I don't know if Linda, because she developed and implemented a lot of that foundational work. So if you have thoughts on that, Linda, happy to hear them.
I think you hit the nail on the head. We had done quite a bit of similar, not the case crossover or Emily's work, but the work around observational studies standing outside of schools and the collision analysis prior to this, but just in Toronto. So if you ever care to look up my PhD thesis, that's what it was all about. And it was just Toronto. And I think what we realized through that work was the importance, like Brent was saying, of looking at different cities, because as we all know, the issues in Toronto are not the same as everywhere else. So we were able to get on board quite a few cities. We were lacking the East Coast. We couldn't find people to collaborate with there, but we went as far as Montreal. But yeah, so that was where it kind of started with just Toronto, and then we realized we needed to move outwards.
Great, thank you. We're starting to get a couple of questions in the chat, and
I'm in the question and answer as well, Karen.
Yeah, in the Q&A, yeah. Do you want to answer? So there's, I'll read the question out that's in the Q&A box because I don't think the participants can see it. So there's a question here from Joanna, who asks, for Dr. Rothman's work, do you have any sense of what this data might look like for teens, or do you have any plans to study that?
So that's an interesting question. We didn't look at teens. It's a whole other ballgame in terms of transportation patterns and risks for teens. But I do have Lawrence on the call, who is working with the city of Guelph right now to do a study as part of her master's work that is using a school survey that they have that has one question on active transportation. And we're going to be looking at the home built environment determinants, because we do have postal codes, hopefully, as well as the area level around the schools. In terms of, Lauren, can you just remind me what grades again?
Yes, we're looking at grades 4 to 12.
So we'll have some more information on youth as well, but just for Guelph.
Thanks. There's a question in the chat here. Amazing work, Brent, Lyndon, Emily, and team. Emily, if you could please provide further insights on the method used for data collection and thematic analysis for the qualitative data. Thanks.
Yeah, my pleasure. So I'll start with, I joined the CHASE team in 2020. So I believe the program of research started 2016, if I remember that correctly. So the nature of these big kind of grant funded projects is you have many folks working together to do different parts of the work. So I actually was not involved in the data collection of the key informed interviews. Those were done by different members of the research team in each city. And to my knowledge, those were conducted in person. I did help out with the virtual focus groups. So like I mentioned, we used a third-party platform called Upwards, which is based in BC. And it basically facilitates online like a discussion or chat. And you can kind of change the criteria of when you can contribute, et cetera. And it gave folks some time to answer some questions we had, and then also comment on each other's answers. So it was a really great tool to use at a time where we weren't sure what we were going to do with regards to completing those focus groups, because obviously they couldn't be in person at the time. In terms of the data analysis, so thematic analysis is, I would say, by far one of the more flexible analytical tools for qualitative data. It really allows you to do a combination of inductive or deductive coding, depending on what the research question is and like kind of what you're aiming to find out from the data set that you have. There's many resources on that. I'm happy to put some in the chat in a moment when I finish responding. But I find, especially within health research, that thematic analysis is very useful, and you can use it in combination with other frameworks. So example, like the CFR, right? So we were able to kind of see the themes come throughout the data, and then, okay, how do these then map onto this other, like, kind of more clear, discrete framework, again, to answer these questions and to contextualize our findings. So I'll put some resources in there about thematic analysis, and I hope I answered your question.
Thanks, Emily. I have a planted question here from a member of your team who's helping me in the background. Thank you, Moreno. What do you see, this is for the whole team, what do you see as the biggest barriers preventing evidence-based active transportation safety measures from being adopted as policy? Is it lack of political will, funding constraints, community pushbacks, or gaps in the evidence itself? Moreover, are there any critical gaps in current active transportation safety policies? For example, something we know would improve safety, but it's largely missing from city plans. So basically, how can research drive better policy?
You want to start, Linda or Emily?
I mean, I have a comment that's pretty close, but go ahead, Brent, if you want to go ahead first.
Ladies first.
Okay. I mean, in my view right now, based in Ontario, I really feel like we're very limited by political will. And it's interesting because what we're seeing is political will at the municipal level may not match the political will at the provincial level. And that's what we're struggling with, whoever's in Ontario right now. And as far as I see it, that's one of the biggest barriers. Well, right now it's 100% the biggest barrier what's going on in Ontario. So political will is a big one.
Yeah, from my perspective, I think, there's opportunities to zoom in. And I think when we do that, the continued prioritization of motor vehicles is a real challenge. And looking at it, trying to think about zooming out on the problem, as we continue to sprawl in cities, and lack the will to create more dense neighborhoods, I think we're going to continue to rely on motor vehicles for main modes of transportation, which contribute to all sorts of terrible environmental impacts. We've talked about the direct health impacts in terms of injuries and fatalities, but there's also all sorts of other associated types of health impacts from continued use of motor vehicles in terms of pollution and chronic disease. I think if we move toward a holistic view of this problem, continue to implement policies that create more dense communities, the idea of the 15-minute city or the 20-minute city, there's no underlying conspiracy there. It's just an attempt to make cities livable for people and not cities for cars. So I think the more we can move in those directions, the better. I think we are making progress. I think the municipal partners recognize some of these issues, but going back to Linda's comments, there is some political inertia on this, and there's been decades and decades and decades of development for the motor vehicle in terms of engineering our road traffic systems that I think we really need to start moving away from. But it's easy to say those words. It's really difficult to implement policies around that.
Yeah, what I'll contribute is kind of just a rehash of what Brent just said. But as I mentioned in part of my presentation, you can't look at these barriers and facilitators, or barriers in particular, as per your question, in isolation, right? They're all connected, they're all interwoven. When we talk about political will, we're talking about priorities for motor vehicle movement. We're talking about funding being directed to those priorities, right? You can't look at them in isolation. So I think the more that we're able to kind of grasp or kind of illuminate the complexity of how these all operate together, we can at least start to see some of these path dependencies of how things keep getting done in these ways that are not sustainable, that are reproducing this norm, that are that devotes resources to inequitable built environments across Canada and beyond. So I think the more we can come together from different disciplines as well, brings those different views, and we're able to tackle the complexities of the different barriers and facilitators in some more holistic ways.
Great, thank you. And we have another question in the chat here that I think we can answer before our time is up. It says, hi, really great and informative presentation. Is there anything that you would change in your study design or methods to strengthen your conclusions? Perhaps an overlooked confounder, data sources, study design?
Well, having a pandemic smack in the middle of our approach to doing this work was a real challenge to get around. There might have been opportunities to strengthen the approach. We did a lot of interviews by Zoom, which may not have been, as ideal as being in person. So that represented a challenge. But I do think we had some strong methodology, ranging right the way through from Linda's foundational work through to the bike study, case crossover design, and then the unique kind of qualitative analysis that was done. Again, had to shift because of the pandemic, but we tried our best to try and address those kinds of issues. And I do think we have some very valuable data and a foundation that the capacity program can build on.
Great.
Can I? Do I have a second, Karen?
Yeah, you absolutely do.
Okay. Two things I also want to mention that kind of expand on what Brent. First of all, my part was cross-sectional data. We've done a lot of work prior to this and after this, looking more at quasi-experimental methods, looking at why do we see an association between school crossing guards and more collisions? So we do have a whole other set of papers that have been published with this group before and after this study, looking at basically pre-post when things are put in. So that's number one. So that's added on to this. Once we saw these sectional relationships, we wanted to explore them further. The other thing that I really want to mention is we've been relying, not in the case crossover and not in Emily's work, but my work on police reported data, because those are the only data that have collision locations. They really underreport the burden of injury when we look at hospital emergency department visits and hospitalizations. I just want to keep stressing that we're not using the best sources of data, but it's the best that we can do when we need to know where a collision occurs. Hospitals don't collect that kind of data, but there are a lot more of them in hospital.
Great, thank you. So this wraps up our webinar from Capacity, and I would invite you to, if this is your first visit to one of our webinars, please go to our website and take a look. We welcome any feedback. You can contact us through the website, and yeah, subscribe to our newsletter, and we'll let you know when we have another one coming your way. Thank you very much to the capacity researchers who were part of the Chase research team. Brent, Linda, and Emily. It was a wonderful presentation, and yeah, a tremendous amount of work. And yeah, well, we're excited to see how this becomes, yeah, how we bring this forward through the capacity research program as well.
Thanks so much for the opportunity.
Thank you.
Bye-bye.
Thank you.
Take care all.